Apos stands for All Phases of Step Cycle, and it's a new innovative treatment for orthopedic problems, primarily with the lower back, knee, hip and ankle. It is a safe, non-surgical, non-invasive treatment which looks at the customer as a whole. Okay? So we're not just looking at one joint, say the knee, we're looking at the person holistically.
When I first arrived at Apos, I was assessed, first with my medical history, then they started a process of assessing my gait, my posture.
When somebody comes to see us, we give them a free initial consultation. We have a look at them walking on our Gait Right mat, which is a bit of equipment which will look at how a person walks specifically. So it gives us some objective measurements as to how someone is walking.
They were able to actually look at the pressure of my feet on this mat as well as the distance of my steps. They not only look at it on the screen of the computer, but they also look at me physically and they're able to assess as to what is needed.
From there, you're taken through for a consultation with a specially trained clinical therapist, and they will have a look at your walking pattern and they'll also go through what issues you may have with your particular problem. We both decide whether or not the Apos system is something that you're going to benefit from, and if we both agree that it is, you can take away your own pair of Walkrights on the day. Walkright is a specially designed footwear which will actually realign your body's posture and redistribute the load so that you can walk pain-free and with more function.
I take them with me to work every day and I wear them at work because they need to be worn inside on a flat surface, and I find that they've become part of my everyday life.
We ask our customers to wear them in their normal activities of daily living. So, for example, when you're at home, we could ask you just to be using them for half an hour. If work is a better time for you to be wearing your Walkrights, then we'll ask you to wear the Walkrights at work.
It is important that people realise that it's almost like having physio in a box at home, because that's really what it is. It's physio for your legs and your back. And I don't have to get myself anywhere by a certain time. I don't actually have to take time off work to go and have physio. I'm actually using my Walkrights to fit in my day.
They'll know it's working because when they go to walk, they will find that they don't have as much pain, or they may be pain-free, and they will be able to walk a lot quicker and with a lot less energy expenditure. So they'll find it much easier to walk.
My walking has improved. I can actually walk for longer periods. The pain has actually been alleviated, and I'm happy to say that I can actually postpone my knee replacement for a fairly lengthy time.
The treatment procedure is that we see the customer over 3 sessions as part of their package, and we would generally see people about 6 weeks after their first initial consultation, 3 to 4 months, and then 6 months after that. During that time, we will be phoning people up and getting feedback and asking how people are doing to make sure that we're getting the results that we both want.
I have been back to Apos twice now. I've had 2 follow-ups, so I have done another session over the walk mat. They can see where there's been improvement. My Walkrights are then adjusted, and if I'm happy, they're happy, I go off until my next session. I had back surgery just a year ago, and I had got to the point where my recuperation wasn't actually going any further, but having had the Walkright systems, it's actually helped my back strengthen.
Apos has proven success with many patients in reducing their pain and increasing their function. It is easy to comply with and easy to put into your daily life. It can reduce the need for painkillers, and it is safe and keeps you active for long-term wellness.
I strongly believe that Apos has given me control of my life again, because suddenly I can go to the theatre and sit throughout a performance and not be in pain. I can now bend over and pick up my granddaughter and play with her in the park. I'm telling everybody about Apos.